Good afternoon, everyone. Thank you for replying. My name is Keisha Pollack, and I am thrilled to be here today to moderate the final session of the Department of Health Policy and Management series, highlighting various policy topics under the new administration. And this session today is co-sponsored by the Institute for Health and Social Policy and the Johns Hopkins Center for Injury Research and Policy. Today's emphasis is on transportation and transportation infrastructure and its implications for public health. And you might be wondering why we're focusing on transportation. If you've taken my class on transportation policy and health, you know that transportation systems and decisions being made about transportation can benefit or harm health. And while there has been an increasing appreciation about the connections between health and transportation, overall, health is not typically considered in transportation policy and planning, although I'm sure we all can agree that transportation is one of the key economic and social factors that influence health and the health of a community. Even some of you may know that most recently the federal government, through the Community Preventive Services Task Force, recently recommended that built environment strategies include bike or pedestrian transportation systems with land use to help increase physical activity. So that just came out about within the last 2 weeks. So today's conversation is going to explore some broad issues around transportation infrastructure, which includes aging infrastructure and transportation policy broadly. The format today is I will introduce our three fantastic speakers who are all been working in this area for many years, and they have a wealth of experience to bring to this conversation. They're each going to have about 10 minutes to make some comments and to share their insights. After that, we'll have a moderated discussion, and I will look to you for your questions for the panelists. So let me begin with introducing each speaker. Our first speaker today will be Lucinda Leslie, here to my right, who has been the policy director of the minority staff of the Committee on Oversight and Government Reform since 2011. From 2011 to 2014, she also served as legislative director for the personal office of Representative Elijah Cummings. From 2007 to 2010, she was also a professional staff member on the Subcommittee on Coast Guard and Maritime Transportation and on the Committee on Transportation and Infrastructure. Before that, she was a policy analyst with the Maryland General Assembly, working on analyzing the budgets of the operating agencies of the Maryland Department of Transportation, in addition to Maryland's contributions to the Washington Metropolitan Area Transit Authority. Our second speaker in the middle is Adria Turner, who is the new leader at Transportation for America. Prior to joining T4A, Transportation for America, Adria Turner was chief of staff for the District Department of Transportation in Washington, D.C., where she managed strategic operations for a 900-person department and $600 million annual budget and a portfolio of highways, local streets, traffic signals, public safe, bike share, streetcar, et cetera. Ms. Turner served as a senior associate for state policy and fiscal and economic policy at the Division of Pew Charitable Trust before moving to her position. And she also worked with the elected and appointed leaders to maximize data-driven and outcome-focused program management and to think about the use of evidence in budget and policy decisions. She was also with the state of Maryland as both the senior analyst in the Office of the Governor of Martin O'Malley and a special assistant to the Secretary of the Maryland Department of Transportation, where she focused on multimodal transportation solutions and transit-oriented development. Our third speaker is Mr. Ed Christopher, and Ed's been involved in urban transit. I've known Ed for a while. I'm just going to call him Ed. Has been involved in transportation planning since 1979. He has a master's degree in urban planning and policy from the University of Illinois at Chicago with an emphasis in transportation. He began his career at the Chicago Area Transportation Study, CATS, as the Director of Information System. In 1998, Ed went to work for the U.S. Department of Transportation's Bureau for Transportation Statistics. And between 2001 and December 2015, he was the Metropolitan Planning Specialist for the Federal Highway Administration's Resource Center. In 2015, Ed retired from federal service and now keeps active as a transportation consultant. And he actually supports a subcommittee I sit on, or a task force I sit on at Transportation Research Board. So I'm sure he'll share more about that as we move forward. So those are our speakers. And again, we'll begin with comments from Lucinda, and I'll come back up to the microphone at the end for some comments and questions. So thank you.
Hey, everybody. I am honored to join you, and thank you so much for the invitation. I also want to thank my fellow panelists. Thank you. I am here to provide what I guess amounts to the view from Capitol Hill about investments in our nation's infrastructure, and I want to emphasize as I begin that my accounts and opinions are my own. They don't reflect any other person's. Dr. Pollack told me that attendees at these discussions like to hear a bit about presenters' backgrounds, so I'll begin by giving you a brief overview of my background. As she mentioned, I worked for several years at the Maryland General Assembly in the Department of Legislative Services, analyzing budgets for the operating units of the Maryland DOT and Maryland's contributions to the Washington Metro. You might ask how I got that job, and I would say, like many others in the transportation field, it was completely a fluke. I went for an interview with the Department of Legislative Services, and I think somewhere in the many words I spoke that day were the words port and ship, and voila, I was a transportation analyst. During my tenure with the General Assembly, I was responsible for maintaining the financial revenue models, including modeling the gas tax and the vehicle sales tax, and obviously I'm looking at our MDOT maintained models as well. So there are two models, and then there was a revenue process every year, estimating what we anticipate, agreeing on what we anticipated the revenue to be, and that would go into the budget. Saves those kind of nasty disputes later on about revenue estimates. During my tenure with the General Assembly, I recommended some restrictions on the use of Garvey bonds, which were a key financing vehicle for the ICC. They were adopted, but they were later altered. And then I recommended some restrictions on spending on the MagLab system. The restrictions were adopted, and then they were altered about a decade later. So my entire legacy has been undone. In 2005, I went to work for Congressman Elijah Cummings, first in the personal office as a legislative assistant, and then in 2007, when the Democrats won the House, I was his staffer on the subcommittee on Coast Guard and Maritime Transportation, which he chaired. During my tenure with the subcommittee, I organized more than 40 subcommittee hearings, including, for example, a field hearing in San Francisco to examine the oil spill that resulted from the collision of the Costco Busan with the Oakland Bay Bridge. I also worked a lot on the Deepwater Horizon issues, if you remember that gaping hole and the oil coming out. And I worked on long-term investigation of the Coast Guard's procurements and authored some legislation that applied to Coast Guard acquisitions, the Nunn-McCurdy policies that are in place at the DOD. And then I managed Congressman Cummings' work on numerous surface reauthorizations, including Safety Loop, Map 21, and the FAST Act. In fact, that I have to note, the reason I was so late today is that I was over at the new Elijah Cummings Intercity Intermodal Greyhound Terminal. Check it out. That is the last of the earmarks from the old system. Finally being open today. In 2011, after there was an unfortunate election outcome, the Democrats lost the House, and Congressman Cummings became the ranking member of the Oversight Committee, and I moved with him to that committee. And while working on that committee, I have overseen numerous investigations of federal agencies, including the Transportation Security Administration, the FAA, and departments far afield of transportation, such as HUD, Fannie Mae, Freddie Mac, Federal Reserve, the OCC, the FDIC, and most recently the National Park Service. However, I have continued working on the Washington Metro, which is perhaps the one area of continuity in my career, and sad to say, not getting better. So having covered all that, I come to the point, which is I was asked to talk about public health and transportation policy making. I have to say that in my career, I have not seen transportation reflect public health all that much in decision making, and the exceptions to that have been far off the well-worn path taken by cars or pedestrians. While you might know the Coast Guard from their work on search and rescue and homeland security missions, they're also the regulator for commercial maritime activities, including commercial fishing, which is actually the most dangerous occupation in the United States. Back when Congressman Cummings was chair of the subcommittee and Congressman Jim Oberstar was chair of the full committee, we did a lot of work on fishing vessel safety, and that work was really informed by public health considerations. There are this leads me to observe that public health concerns can spur specific transportation policies, but public health-oriented transportation policies, as I might call them, are generally a subset of transportation policy making. There are obviously policies addressing public safety, like the regulation of commercial buses or vehicle safety standards, but public health considerations do not necessarily infuse all or any of the biggest decisions, particularly the cold, hard decisions about spending, which this is the theme that I really want to emphasize. The spending and how we spend really determines a lot of what we build. And I'll start now with the view from the Hill, with the basic premise that over the last decade, our investments have not been enough to maintain our infrastructure in a state of good repair, much less build the new infrastructure we need to keep pace with increasing demand. I'm sure you know Congress passed the Fixing America's Surface Transportation, or FAST Act. Absent new legislation, the FAST Act will guide investments in surface transportation through 2020. The Act authorizes just over $300 billion for surface transportation between 2016 and fiscal year 2020. And while that sounds like a lot of money, it's really just slightly above existing funding levels and programs that were in place before the FAST Act was enacted. In addition, nearly a quarter of the bill is paid for by sources other than the federal gas tax, which has not been raised since 1993, and as a result, as T4America has pointed out, if no new transportation legislation is enacted before the FAST Act expires, the revenue hole that would have to be filled to continue even flat funding for transportation would be significantly deeper than when the FAST Act was enacted, and I'm sure we'll hear more about that. Many in Washington now seem to be coming around to the idea that we must expand our investments in our nation, and particularly in infrastructure. But that said, the pathways that the investments take to flow to our infrastructure will largely determine what will actually be built. In the speech he gave on the night he was elected, President Trump said, and I quote, "We're going to fix our inner cities and rebuild our highways, bridges, tunnels, airports, schools, and hospitals. We're going to rebuild our infrastructure, which will become, by the way, second to none, and we're going to put millions of people to work as we rebuild it." Thus far, however, President Trump has not provided any specifics on his plan, and the mechanisms for building highways, bridges, tunnels, airports, schools, and hospitals are, in many cases, very different from one another. Trump's advisors issued a paper late last year that seems to suggest that his strategy for expanding investments is to offer a tax credit. Tax credits can be important tools, but the reality is that in the infrastructure arena, they would spur investment only in those projects that can generate revenue to pay back the investors, like, for example, tolled highways. Tax cuts will not meet our need to make investments to address deferred maintenance on existing systems, or to build rural roads, or rehabilitate bridges or roads that aren't tolled, or to build transit systems. Put simply, they would not build the infrastructure that is so urgently needed to expand connections among all communities. Relying on tax breaks to spur private investment in what should be public infrastructure will simply repeat and likely worsen the kinds of decisions made in the past that left too many communities behind. And if funds are not channeled through current federal procurement processes, or if those processes are not applied to the funds, then we will not be able to ensure that there are, for example, disadvantaged business enterprise requirements on the expenditures, or Davis-Bacon, or any of the other requirements that attach to the existing federal programs. And this brings me to my final point. Too often we have failed to make investments in a way that ensure the infrastructure we build creates connections rather than building barriers. Anyone who lacks a reliable method of transportation is going to be impeded in carrying out the basic tasks of everyday life, and yet there are millions of Americans in urban areas and rural areas who lack a method of transportation on which they can depend. And sadly, in some cases, this was by design. As the U.S. DOT wrote under President Obama, quote, "There is a regrettable legacy of aligning and designing transportation projects that separated Americans along economic and even racial lines. The evidence of this legacy and its impact on creating spaces within which particularly low and moderate income communities and communities of color live is everywhere around us, including very visibly in Baltimore. Too often, however, we don't stop to think how the physical connections or barriers that exist in the world are the manifestations of intentional decisions, and we don't consider how those decisions are made and reinforced by the way we expend money on transportation. As we consider new investments, we should consider that we cannot ensure the future we build with the investments we make today does not perpetuate this legacy unless we trace the lines drawn through our lives by the flawed decisions of the past. And as I said, if new money is not flowed through planning processes that force careful consideration of the projects, new investments just by themselves will not create opportunity and expand mobility for all. Every discussion about transportation should reflect our need to ensure that every dollar we spend helps to build bridges over our divides and move every American forward. And my key point is this: how we make those investments will be critical to shaping the infrastructure that is built, and whether the infrastructure creates connections or barriers. I'll stop there and look forward to the presentations from my colleagues.
Thank you.
Hello, Adria Turner with Transportation for America. So I am about 2 months into my new job, and this is probably my 10th speaking engagement. Thank you, Erica. Might as well just jump right in. I come most recently from the District Department of Transportation in DC, but I'll back up and talk a little bit about how I started working in transportation. So I was actually a psychology undergraduate. Couldn't figure out what I was going to do, with the rest of my life, and ended up working for the city of Greenville, South Carolina, and fell in love with local government, and actually went back to school for public administration in South Carolina. And I was working there for a community development finance institute on affordable and sustainable housing. And what I learned very quickly is in order for communities to be affordable and sustainable and healthy and connected, transportation is a pretty key element of that. The other thing I learned is never say never. So I was working on tax increment financing legislation at the state level there to allow TIFs to be used for sustainable development. So think smart growth development. And we actually were successful working with the Urban Land Institute, Affordable Housing Coalition of South Carolina to get the TIF legislation passed. Then Governor Sanford vetoed it. We were able to override the veto. And there's a point to that story. So I then went to work for Governor O'Malley's office as a policy fellow. And the way they lured me to MDOT was to say, we've got some TIF legislation that we need somebody to work on. And when I was in South Carolina, I said, never again. So never say never. I actually was working on transit-oriented development and just policy and legislative affairs at MDOT. And I fell in love. I was officially a transportation person. And I think part of the reason is because it does touch every area of everyone's life. And if you think about communities, which I'm particularly focused on from a public policy standpoint, transportation is the key element to building communities. So in terms of economic development, economic mobility, health, all of the key outcomes that we hope to achieve in building healthy communities, transportation is certainly an essential component of that. So my time at MDOT, again, the TIF legislation is a little wonky, so I'll save that. But I had the opportunity to work on the funding bill for Metro back in 2009, where we amended the Interstate Compact to allow the system to get federal funds. Never say never again, because then I ended up working on Metro legislation this past year. So things have a way of repeating themselves. But certainly through my experiences at MDOT, in the governor's office, and at DDOT, I understood how important it was for local governments and local communities to step up and take a leading role to make sure that the investments that we're making in our transportation system work for our communities. So we're not building big highways that move people quickly and kind of forget the communities that they could be, connecting. I had the opportunity to come to Transportation for America, and something that was really appealing to me was that the organization that really started to work on a surface transportation bill. So in 2009, Transportation for America was formed to influence what officially became MAP 21 in 2012. And after that, the Smart Growth America, Transportation for America took a hard look at what the next step was for the organization. And they said, the future is in the local communities, and that's where we're going to start to shift our focus. And so over the past several years, that's what they've done. And the programs that T for America is running, they connect very well with Smart Growth America because, as I said, you can't separate housing and development from transportation, and everything needs to work together as smoothly as possible in order to make it work for the communities. So we're working on programs that build capacity at the local level. I was talking to my colleagues about some of the academies that we're running, where we bring business leaders in, local elected officials, and others to really understand transportation, understand the financing, understand the options, understand what a complete street is, and how if you build a street mindfully with the design of all of the users in mind, that you're going to achieve much better outcomes. It improves safety, it improves health outcomes. On the health side in particular, we've been working a lot in enhancing performance measures and the use of performance measures. And not just in health, but you can utilize enhanced performance metrics to make sure that you're investing in the projects that have the greatest return for the communities. Certainly taking equity and other elements into account along with health and the outcomes that you're hoping to achieve. We actually have a lovely report on our website that I will shamelessly promote right now because I think it's actually right in line with what we're talking about today. And this report, which is called How Regional Transportation Planning Agencies Are Promoting Physical Activity and Health, highlights policies from across the country where local communities are really taking positive steps in the right direction to prioritize the investments that do lead to health and equity outcomes. So I will stop that for just 1 second to kind of follow on to what Ms. Leslie said. The focus at the local level is crucial, and it's what inspires me. And I think that's the reason that they asked me to be the director of T for America, because I brought a local perspective. That being said, we assumed that we would have continued support at the federal level for the programs that are crucial to communities. And unfortunately, what we've seen in the last few months is that that assumption is not necessarily safe. So at the same time that we heard, $1 trillion infrastructure, the administration's skinny budget proposal, so the outline that they put out telling Congress how they wanted Congress to fund the government cut transportation. It cut funding for new starts and small starts, which is basically all of the new capital transit infrastructure. It cut out the Tiger program, which is a fantastic program, discretionary grant program that really rewards innovation. That program funds projects that are multimodal, that are regional, that are often difficult to fund through traditional federal funding sources. And it requires, communities to show local investment, return on investment, and make sure that they're really taking the steps to make the right decisions. So unfortunately, while the administration on one hand is saying $1 trillion infrastructure, which is actually a pretty effective tactic, because when I'm calling people to say, you realize that your projects are at risk, but they're like, but $1 trillion. I'm like, let's look at that a little more closely, because you can say that or tweet it or do whatever you do, but the real action was actually a disinvestment in communities. It wasn't just transportation. It was cutting funding for community development block grant programs at HUD. A lot of what we talked to our coalition about was saying, the message is invest in communities. I was speaking at a conference recently, and they said, we get that what you're saying is important, but where do we put this on the priority list? Because there's healthcare, there's housing, there's transportation. And I said, the best thing I can tell you is to reinforce that you want to invest in communities. We shouldn't lead with the assumption that we're going to cut $54 billion in discretionary grant programs to build a wall and to finance enhanced defense capacity. Like, that warrants further discussion. Economic strength is in our communities. And so I think that we really need to lead with that and to counter the argument that security relies on, disinvestment in our communities and shifting funding to other sources. The other thing on the infrastructure package to remember and Ms. Leslie also touched on this, is that financing isn't funding. And so if the goal is to leverage more private dollars, which is what we've heard because there are no new revenue streams and we're not likely to see a new revenue stream without tax reform, which is not likely to happen without the Affordable Care Act passing both chambers. So it's kind of a little bit of a chicken and egg scenario. We're looking at financing instead of funding, and the communities that are going to be able to step up are those that likely already have the resources available to them to go to the ballot box and raise local funds. And there's a big section of middle America that's going to be left out of that. They're not going to have access to the financing. They don't have the sophistication sometimes that it takes to understand the complexity of those financing models, but they also don't necessarily have the political climate in which they can build the local support to raise the funds that they would need to leverage the financing. So I can stop on that. But, I think that the message there is let's not get distracted by trillion-dollar infrastructure, while on the other hand, actions are being taken to disinvest in our transportation network.
Thank you so much.
Yep.
Cool. I get to start with how I got into the whole transportation planning game. As a transportation planner, and the way, we do a lot of route planning and that, it's usually the point of least resistance, and my career followed the point of least resistance, but seizing opportunities along the way. As an undergrad, I was a political science major. Why? It was the least amount of hours that I needed to get a degree. So I took political science, and allowed me to take a lot of different other classes. However, learning and getting my technical background through behavioral science, I think, is a key. The next thing I did is, when I was a senior, it was like, what am I going to do? I had no aspirations of where I was going to end up, but somebody told me about this master's program that was just starting up in our school in urban planning, and you didn't have to take a GRE to get into it. So that goes into the master's program. I'm there a year, running out of money. Get an assistantship. So I got an assistantship to pay my tuition, and I got a little money out of it. Well, I ended up writing a regional ride-sharing grant application. Ride-sharing at the time was carpooling, vanpooling, and this was big in the late 70s because of the energy crisis. And as we were developing this grant application for one of the regional agencies, the graduate students get to go to sit in the meeting with the agency people, and it happened to be with the Metropolitan Planning Organization, and they were putting together a report called the Transportation System Management Report, TSM. It's got to do with making the systems operate better and more efficiently, the way transportation defines them. And I said, where's ride sharing in your report? And I asked a lot of questions, and I picked on their report. And 2 weeks later, I got a phone call saying, hey, do you want to work here? I said, sure. And they ended up hiring me, and because my assistantship was ending, and I started June 17th, I'll never forget it, but the day I walked in the door, I got a check for this, or July 17th, I got a check for the first 2 weeks of July, because they had to put a name in a box or they were going to lose the position. And that's really how my whole career spun into this thing. But along the way, and I was always in more the technical side when I got into planning. That's why I went into transportation. It was a little bit, to me, more technical. In my program, we could have became community planners, and I would just tease the community planners that they were too soft. They were on, how do we hold a meeting? And it was just not soft for me. Transportation had metrics, they had formulas, they had equations, and I had a little bit of a science inkling, and I went into transportation planning. Another specialty that was just coming up was health in our program, and I used to tease my friends in the health program, like, what are you going to do when you get out? You're going to, forecast how many hospital beds you need? And, it's kind of ironic that I would bust on these people in graduate school, and years later I find myself at kind of this nexus of these two different worlds. So throughout my career, I hung around near the Transportation Research Board. That's the place where the academics go to try to get published and bring their research, and it's really all about research. And I would go to their meetings, and I always had, again, this science, researchy side to me. And when I worked at the MPO, I always said everything that we do is a behavioral experiment. We build a light rail line. It's kind of a behavioral experiment if people are going to use it. I mean, we got a model that'll figure out how many people are going to use it, but it's still guesswork at the end of the day. We want to do alternative work hours or things like that. You know, there's a lot of collecting the information before and after, seeing if it worked, and if we find 6 other places where it worked, we say, hey, it's a good idea, we're going to do it. So there's a lot of behavioral science in the transportation side that goes on kind of continually. I've always maintained it's this constant experiment. So, of course, I played with and hung with the Transportation Research Board, published papers, and did everything you should do. Then as I was growing up, I became a committee chair, and I chaired the Urban Data Committee. And at the time, this was in the mid-'90s, I got a reputation of being able to find reviewers for hard-to-review papers. And at the time, travel time, speed, and reliability was a big issue. We were getting these papers from these academics that would tweak one little algorithm and how the formulas were calculated. And it was stuff people just didn't really know well enough. And I could find good reviewers. Well, fast forward that to the mid-2000s, TRB, Transportation Research Board, through the travel forecasting community, starts getting a lot of papers relative to health, but they were coming out of active transportation, biking, walking, and trying to incorporate that into travel demand models, travel forecasting models. Well, some staffer said, oh, and they didn't know what to do with these papers. Some staffer says, well, Ed can find reviewers. So they set me up behind the scenes as a virtual chair to find reviewers for these papers. Did that for 4 or 5 years. And then the Environmental Justice Committee wanted to start a subcommittee on health and transportation. TRB staff got a hold of that and said, well, you got to bring Ed in. He's been doing this stuff for a couple of years. So then I became a co-chair of this subcommittee on health and transportation. And to believe me, when I started this out 6 years ago, I couldn't say epidemiologist. Now it rolls right off my tongue. So I've learned, and it's been nice because I've had smart people around me on the health side. And I want to say from a transportation perspective, you folks that are working on your MPH degrees, can I say that? You know what an MPH is? In my community, if I say it, they say miles per hour. And I was telling one of your students today that I was talking to, the degree, you guys are real rigorous in the technical side of your degree. And I'm starting to find more health people working in transportation agencies, and I think you're getting hired because of your technical skills and your technical abilities. So that always impressed me, and I worked with health. Okay, I want to get to Keisha's question. It kept me awake for actually a couple of months. Can transportation infrastructure be a win for public health? The party line you're going to get from a lot of transportation people is, of course it can. We wouldn't build a project without any safety or air quality benefits. It's built into our methodology. We consider safety, and that gets waved up. That's the flag people will wave. I'll call that the party line. But I'm going to say, I think that when I talk about public health and population health, and the folks in here and you guys were, I think we're talking about something totally different. We're not talking about project level stuff and safety and air quality necessarily, although those are positive benefits. I think we're down at more of a neighborhood level and a person level, and how does it affect the people? I think we're talking about things like equity, physical barriers, dividing neighborhoods, noise, environmental justice. I don't know if that's a term people know, we can get into it into questions. Pedestrian barriers, accessibility to services, design type of things, mental health, urban form, all these things that I would say are tied to the social determinants of health. Something else I learned from the health people. Don't ask me to name all 5 of them and what they're all about. And my favorite when I started to learn this stuff was social capital. The health people, I kind of nod, they kind of get that. When I was a transportation planner growing up in school, we talked about, how do we make things good to people happy? I'm blanking on the term that we used to try to come up with, but we couldn't measure it. Give me half an hour, I always say. But when I learned social capital, the concept of what it was like the health people got this thing figured out. Quality of life. Took me less than half an hour. We always talked about quality of life, but from a transportation standpoint, we never had metrics for it. We could not measure it. I meet the health community, and they've got this thing called social capital, and they can actually define what it is, and they have metrics for it, and it's measurable, and it's like, that starts to encapsulate what we mean, I think, when we say quality of life. You go to TRB, though, and those two, you can line up on different sides of the aisle and argue back and forth, and you start splitting hairs. I'm kind of being generalistic here. But what I want to assert and suggest is we don't have the capability to analyze and do the simple assessment of the health benefits that are related to our transportation projects. We don't have the metrics, the analytical models, or even the right mindset to approach the problem. I'm not talking about HIAs either. HIAs go in their health impact assessments. They go in their own separate box. We can talk about those totally separately. But I'm going to say this is where you guys come in. I don't know about the MPO guy. You don't come in here. You're freight and safety. I mean, you're in a box. But I think we need you guys, Keisha's students and folks in these types of programs, to start to think about this stuff. And really just what questions do we want to answer? How do we go about answering them? Defining metrics. And we need new metrics. I was in a meeting last week where a health person who came from the transportation community was suggesting that maybe we need a health LOS, level of service. On the transportation side, we measure projects, on level of service, and we got nice pictures. Is it A, B, C, or D? And it relates to things like volume and speed and capacity. And I had to chuckle because I'm in other meetings where transportation people are saying, we got to get rid of level of service. It is just this arcane metric that doesn't capture everything that we want to talk about. But again, we need a way to bring health from metric standpoint. And it doesn't have to be how many people are going to get killed or live longer, but we have to be able to bring that into our process and our thinking. And this is not something that you're going to go home and come up with a great idea tonight and write it down. I think it's going to be a much bigger collaborative effort. We need tools. We got some tools that are getting developed. I'll throw an acronym out there, ITHM. The biking community loves it because it's, you can say if I build this route, how many people are not going to get killed if we build this bike path. And there's others out there. There's HEAT. There's kind of a litany of acronyms. But we really don't have good technical tools to do this fusion. Institutional frameworks. We're just scratching the surface on institutional frameworks. And one of the things, I did some research and some looking because I knew BMC folks are going to be here. And when I deal with MPO directors, one of the questions, when I can talk to them on the side and we start talking about health. And by the way, MPOs, they're really down there with the people. They're run by mayors, and they're dealing with health questions. And they're starting to bring health dialogue into their processes, much more so than state DOTs. I'll tell you about a little experiment I did about 4 years ago. But the MPOs are starting to develop these institutional frameworks to bring health in. But the question I always ask the transportation directors, do you got any health officials on your policy board? The policy board is the final board that makes the decision. They're the decider. And it ain't happening anywhere except Rhode Island. But Rhode Island's kind of a funny case in itself. I'm looking at you, Erica, because you might be able to help me if there's another one I don't know of yet. Yeah, but Rhode Island has the state health director on the MPO policy board, but Rhode Island is a funny metropolitan planning organization because the whole state is the MPO, so it's kind of a state agency to begin with. And we can question, answer, talk about what MPOs are. And one of the things I want to say is don't get trapped modally. What's happening is we get the bike community and the walking community banding together over active transportation, and they become this strong vocal push point. And when I'm talking public health, I don't want to go down a mode. I don't want to just focus on equity and environmental justice, because it's in the transportation world, we love to think in modes and these little individual compartments, but we need to be a little bit more comprehensive in how we come up with metrics and what they are. And then I think there's a whole thing we can do with reviewing HIAs and the HIAs that are out there and their processes, and we could ask questions about that. One of the things I want to mention, because you brought up process. I loved it when you started to talk about the process, and I thought you were going to go down the path that President Trump when he was talking about this program originally, said he was going to have a czar. He didn't use the word czar, but a transportation czar that would be the picker of the projects, the decider. And last week I picked up some guy named Norman Anderson. I don't know if he was picked. It was kind of an article I stumbled across that would prioritize these big ticket projects. And we could run through the list and give it a thumbs up or thumbs down. Does it have a health benefit? I mean, we got these big ticket projects, but that's not the way our regional processes work. And our state DOT processes are getting a little bit better about having a better project selection process. It's a little bit more inclusive. So I was happy you brought up process, not this idea of you've got some czar that's going to be decider of here's the list of projects. So.
Great. Thank you, Ed. Thank you for those comments, and I want to just thank all of the speakers for very provocative and interesting comments. I just want to open it up to questions. I have several, but let me just begin by seeing who has questions in the audience for any of our panelists on ideas that were discussed or presented today.
There's one.
Yeah. Brent,
Do you
yeah.
have any comments on near-term issues around policy for alternative for automated transportation?
So thoughts about automated transportation?
The automated car vehicles and the driverless vehicles and that sort of things. I got interviewed about a year ago now by some think group that was trying to put together what are the questions what we should be answering. I don't even know if this is on. But that's one of the things, again, being more in the research world than the policy world, I think it's incumbent on us to figure out what questions we need to answer. Because we hear about all the stuff of, how do you deal with the pedestrian who doesn't act rationally, and, can these sensors pick it up and all of that. So I know I didn't answer your question.
So actually, at Tea for America, we've got a whole initiative called the Smart Cities Collaborative, and automated vehicles and shared mobility are components of that. The collaborative grew out of the US DOT's very successful Smart Cities Challenge. If you're familiar, it was a $40 million award to the city that won. It ended up being Columbus, but then you have all of these other cities that are very excited about promoting these policies. Part of the issue is, and I can speak from a city perspective because I experienced this when I was at DDOT. Right now, a lot of the policies are being driven by the private sector. They're leading the movement in a very proactive way, and most of the time right now, when you're seeing a policy, whether it's a piece of state legislation or even a regulation rulemaking that's proposed at the local level, is largely being driven by the private sector. And it's to make sure that they're getting the regulatory approvals that they need to operate in that space. What we're working with our collaborative cities is to say, okay, we're all banding together because you guys are all working on these different projects, whether it be AVs or other smart infrastructure, shared mobility, connecting that to the transit system and how to make all of the pieces fit together. But what we're really looking to do is to give them a space where they can share ideas and come up with policy platforms that work for the benefit of the governments and for the residents, right? Because otherwise, you can't count on the private sector to think about equity and environmental outcomes and some of the externalities that governments and officials are going to focus on. And it's really going to be up to them to make sure that those elements are included in the policies and laws that come down the framework. I think where we are right now across the country, there's certain places that are leading. I would say many of them are probably on the bleeding edge as opposed to just the cutting edge. They're going to be making the hard losses, hard mistakes that will then lead to good policy. But I think folks really need to be open to piloting projects and knowing that they're going to learn tough lessons. But I think that broad policy and broad regulations are still very much under development.
Great, thank you. Yeah.
Perfect presentation, very stimulating. Is there any city in the United States or in the world in which you panelists feel that they've fixed the transportation issue and improved the health of the population? Made that difference. Any place in the world that's actually done it?
Our professor should know.
I have my thoughts, but the question was to our experts here on the stage.
Yeah, you're asking me, and it's kind of a utopian question. And being a regional planner, I've struggled with it, and I used to, during my career, say the beauty, and I'm from the Chicago region, the beauty behind our region is we have anything you want in terms of lifestyle, housing mix, because we haven't figured it out. So I'm struggling. I mean, there's little examples here and there of the different programs that are out there, but does anybody out there have any that they'd tout?
I think I would come back to the question, how do you define that it's fixed, and is it fixed for everybody, and do you know that?
Its population is healthier due to the transportation network than the other cities of comparable size.
You have to look at those county health metrics that come out of Madison and look at them over time. Because I know Tennessee got into the game.
I would say Nashville gets held up. Nashville MPO
Nashville gets held up a lot, but the proof is still in the pudding with them. And what they did is they changed their project selection process to slant it more towards projects that affected health. But when you dig into it, they really slanted it towards, bike and ped and transit type of projects. But they changed their project selection criteria. And they did it because they ranked real bad on obesity metrics. And, it's left to be seen, did it work or anything. And the state of Oregon has just partnered with their state health department and added health metrics. They tell me, I haven't dug into it to know what the metrics are, into, again, their project selection process. And I keep saying project selection because to me that's where all this planning stuff really boils down to. Erica, you had a city maybe?
I actually work for Smart North America, which is a parent organization for team forms of just background. People are holding up Bogota a lot right now.
Yeah.
Because they need some quality. They built up their transportation network. It tends to touch a lot of both rich and poor communities alike, and helps all of their community move around the city much better. Mayor, his last name Rosa.
That's right.
That's right. He's on the speaker circuit a whole lot. But then there's also, the Netherlands often gets held up, especially Amsterdam, because of how bike friendly it is and the culture that bicycling does provide greater health benefits and things like that. So Amsterdam gets held up a lot. Nashville, that's kind of like the unexpected choice, right? Because it's not European land concept.
Right. Yeah, I would have said those same, probably added Copenhagen to that list too. That's being held up a lot. But in the U.S., there continues to be a lot of conversation around Nashville, which because of they've embraced health and all policies around their approach and increased bike and ped opportunities. Some of the initial data has shown some increasing in walking and biking and physical activity. I still think we need more long-term research, but in terms of sort of the systems, that gets talked about a lot in terms of a transportation system.
Yeah, and they've also, we at MPOs do what we call household travel surveys, their diary survey, and they added health questions into their household travel survey, and they're building that into their analytics. But I wanted to mention from the process standpoint, I always like to tout out DVRPC, Philadelphia Regional Agency, and one of the more subtle things that they've done is MPOs, what they're best at doing is forming committees to look at things. And the joke, whenever a question would come up, when you work for an MPO is, well, let's form a committee. So, and there's elaborate committee structures. DVRPC has a committee that has health in its mission and its scope, and it's funded. They've got funding for a couple of years now through what's called their Unified Work Program, which is the money that the planning funds that the MPO spends on doing their planning activities. So I like to tout DVRPC from that process side of things. They're doing some other stuff too. And the more I sit here and think about it, more will generate, because that's how we're kind of selling this, is with case examples.
Great. And Adria, you have something?
Yeah, just one additional comment. We're partnering with the CDC and the American Public Health Association, and a lot of that work at the MPO level, we're coordinating with them very closely to not only promote the policies, but to measure the MPOs particularly that are doing this well. DVRPC, we're actually working on a case study to highlight them that'll be out soon. We have actually a staff person embed at the Nashville MPO. that is continually promoting health policy and the intersection with transportation. So while I don't think we can point to any U.S. city right now as a leader, this is a huge component of what they're hoping to achieve. Every time we go in and have a conversation with local leaders about performance measures and what they want to measure, health is usually number one. Health and equity, and then environmental outcomes, GHG reductions. But it's certainly up there. So I think the more we measure, the better decisions we're going to make, and then we'll be able to actually see what the outcomes are of some of these various decisions.
Great, thank you. Yeah, Andrea.
Thank you for a great session. It's really interesting. I have a question about when you're looking at these health benefits of transportation systems that promote physical activity and so forth, and you're looking at the health benefits, are people also looking at unintended consequences or negative costs, like more head injuries from not wearing bike helmets, or
We don't talk about unintended consequences at all. I used to always scream about that when I was at the MPO, that we only tout the positives that are the metrics that people want to look for, but I've not seen that.
Yeah.
So I don't know about measuring those elements particularly, except for that you're measuring from a safety perspective. So you've got a lot of cities that are leading these Vision Zero initiatives. I think it's important as you think about a transportation network that is more bicycle and pedestrian friendly, that you make sure that you're designing the network appropriately with those users in mind, and that it is a complete streets model, which is, when the street's designed, you're thinking about the pedestrians, you're thinking about the cyclists, you're thinking about the transit users and the vehicles and how they all work together. So I think that part of it is making sure that you're incorporating those measures into the promotion of more, active transportation models.
One of the things we're talking about in our task force, our arterial task force, is this notion of engineers use models. When a community calls them and says, we got a little downtown parking problem, or we got this network flow problem, small towns, and they call on the engineer to take a look at it, the metrics they use is what we're talking about. We need new metrics that are more holistic. But again, it's easy to sit here and say, we need it. I don't know what they are. And that's kind of the nut that we have to crack. But we aren't going to crack it talking to traffic engineers without having some of our health minds in the room.
Great point. Yeah.
This is a corollary question. In terms of transportation, looking at cities domestically, gentrification is true that that implications on transportation and public health implications. My question is, us as public health professionals, researchers, and potentially students, how can we, as you mentioned earlier, equity as a narrative in the discussion, but how can we infiltrate that so that it truly is at the forefront? This gentrification certainly favors certain demographics, while other communities are completely marginalized and defined. So I would love to hear.
So I think the main thing there is, there's an interesting observation that came to me. I was talking about the 10 million foot level, which is the federal. What you've heard here is more of the local perspective, where the decisions are made, and the federal programs give you the opportunity to be innovative, to reflect numerous types of considerations in your decision making, but they don't force that. I fear that the federal processes will go backwards. You were asking about regulations. I guess it'd be nice to regulate driverless cars, except that there's a new requirement that we get rid of 2 regulations for every new regulation we create. And that means you're destroying what you have in place in the effort to create new regulations. So I think the fundamental answer to your question is we have to change the way transportation is seen. It should be a civil right, because it is central to all of the other aspects of your life. I was just mentioning, coming from the opening of the new Greyhound facility, how important inner city buses are and how seldom that type of transportation is discussed. I think, to the point that you made, is seeing it holistically as serving urban areas and serving urban needs, but not forgetting transportation's central role in that, and seeing transportation, as with health, as an essential civil right. And that is, I think, more important now than ever, because if you have a czar or whatnot making those decisions from on high, none of these considerations are going to filter in. And frankly, they don't filter into the federal processes when it comes to congressional decision-making right now. And they won't unless that narrative is changed.
I want to jump on that just too, because one avenue is do your research on that topic. And we, Transportation Research Board, every August 1st, you can submit papers. And papers get reviewed, they get a peer review, and they get accepted or not accepted. They go to committees that are specialized in whatever the topic area is. And the task force has a call out, and anything dealing with arterials and health, we'll take it, we'll review anything. And the subcommittee does too. And you don't even have to be topical. You can be out there. Something that someone wasn't even think about, but it has to, we'll go through a process there. And the reason I bring that up, because in the health side, you guys got your journals and all that stuff too. But what I've found out is if it's not in our stuff, our literature, it don't exist. And the health people seem to be the same way about it. Because I've come up with questions like, simple questions, like I had a state transportation director come to me and say, our biking community says our database on bike fatalities stinks, and where can I get a hold of bike fatalities? We don't have that anywhere. And this is the state data guy asking it, and I put it to my health people, and I said, oh, we answered that a long time ago. You can go to your hospital, and there's blah, 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 index of this and that, and it was like, this guy's making the policy on the transportation. You don't know that. So, again, I encourage, write papers and, try to bring it up from that ground up.
I have two suggestions to piggyback on that from the local perspective. I think one is making sure that you've got leaders that understand the importance of equity and that you have to really be mindful about how you're making decisions and set policies that promote equity. I can give you two examples from DC. We have a great bike share system. Capital Bike Share, if you're familiar, is fantastic. It goes across 3 jurisdictions. But when we did some demographic analysis, we saw that there was an underrepresentation by minorities using the bike share. So we started creating proactive programs to make sure that we were engaging across demographic areas. And what are the barriers? Is it an economic barrier? Is it just a lack of familiarity with the mode? Is it safety? And we started to dig in on some of those questions to make sure that we were creating a system that was friendly for all users. But sometimes that takes a few extra steps to be proactive. Another was a contract, and I won't say the company, but it was a shared mobility company, and we required them to keep a pool of their vehicles in an economically depressed area of the city, because if it's there, it's more likely to be used. But if you're just relying on the market to place the vehicles across the city, it's not going to be equitably distributed. But the final point, and I think what we are really working on at Tea for America, is something that's very important to me personally, and throughout my career I've seen what an impact it can make, is community engagement. So in order to make sure that the communities are adequately represented and that you've got a network that is responsive to their needs and equitable, they need to be engaged. And we're working on projects across the country that are tackling ways to engage communities that aren't typically engaged. And we're actually being creative, as in incorporating arts and public art and using that to make folks feel more connected to their transportation systems, but also to promote anti-displacement and to make sure that communities are banding together to protect the heritage of their community and local businesses when you do have, a new transit line come in, for example, that could displace the essence of the community. So I think that really targeted community engagement is going to be crucial to making sure that equity remains part of the discussion as we continue to build out our transportation system.
It's interesting. We got two different perspectives here. You're coming from building community, and I'm coming from I'll beat you down with the information.
Well, I think that it's going to take it's a
So I think
multi-pronged strategy.
together we got something here.
Yeah, I mean, I think for researchers, we should definitely be contributing to the science to help change the narrative. I think that's really what it comes down to. How do we change the narrative for people who are in the space now, who are coming into the space? Are we training future professionals to think about equity and access? Are we, when the conversations come up around gentrification or displacement, are we talking about transportation? I think that there's a lot of that we could do at the community level. And I would even say beyond community engagement, it's community influence and power. How do people feel like they really have a voice beyond just being engaged? And I think that all of that is part of it, and it's changing that narrative. There are many people I talk to who think transportation's not a social determinant of health. I mean, and that's our bad as public health people if we're not getting that message out. Yeah. Other questions for our panelists? Did you? Yeah, Brian.
So I got the chance last week to see Dr. Seema Iyer speak from the Baltimore Neighborhood Indicators Alliance at the University of Baltimore. And one of the things she said, I hope I don't misquote her here, but she said that we see in health outcomes that your zip code can have a bigger determinant than your DNA.
Yep.
And the idea there was that if you think in terms of neighborhoods, that there's a lot of environmental factors in neighborhoods that affect health. Another thing she pointed out was that the average commute time from a neighborhood is a big determinant of a whole bunch of other outcomes, even more so than local school test scores, even more so than crime rate. And that's a big issue in Baltimore. We have neighborhoods that are where people are enduring long commutes. Unemployment is high, but also those who are employed are spending long time getting to and from work, and that affects the social capital and other outcomes. What I'm curious about is there anywhere in the country that's taking that on, that's saying, that seems like something that the transportation planners can solve for. Let's find the neighborhoods that are cut off and let's make sure they have more efficient access to jobs. But are we doing that anywhere? Is anyone taking that on?
That was a huge effort that started under Secretary Fox, and it takes a while to put brakes on stuff. But access to essential services, I mean, it actually emanated from the White House, but it got translated down the line, and you've got region after region after region that's mapping out access to services. BMC's done a lot of stuff, and they were one of the national leaders on that stuff, being able to start to, show the pictures of access again to services, and some areas boil it down to essential services. And on the transit side, it's a big deal, a big initiative for FTA to deal with the idea of getting people to their medical appointments, and it goes way beyond public transit services. I was at a session last summer, and there were the health providers, the insurance companies, and all these groups that you would never have heard of that are providing different community services to get people health service. So I'm going to say that side is, a lot of work has been done on it. I wouldn't say that it's not, but.
Yeah, listen to.
I was just going to piggyback on that and say, and again, I'm looking at the 10 million foot level. We were just talking about JARC. I mean, Baltimore used to compete very effectively for JARC, job access and reverse commute, but several bills ago, it was turned into a block grant. Why? Because what is the number one thing, frankly, that is being looked at when the authorization bill is being done? The last thing that's going to be looked at before it goes to the floor is what's called the state runs. The rate of return. What is my state getting? It is not about equity. It is not about what is a fair distribution across the United States, or even why do we have a federal program and can we pool our resources and do these large projects, inner city, from one city to another, interstate projects. No, it is what is my state getting, period. And that, at least at the federal level, is a huge impediment to addressing some of these issues, which is why the local issues are local approaches and local innovations are so important, but as we've seen, they're also contingent on what happens in the political environment in those local areas. That's why I think, these are significant issues that need to start also at the federal level, because they'll flow down to how programs are structured.
Last question for today. Yeah.
So kind of piggybacking off of that, the fault of these block grants, it's just money that don't have state politics. How do you make sure, what role can the federal government play in ensuring that the states who are receiving this money are receiving it in the right ways and benefiting communities that truly need it? What tools does the federal government
you can create policies to do anything you want. But right now, we're looking at a scenario where probably the next thing coming down the pike after the healthcare bill is an effort to block grant almost every other social welfare program, and including, SNAP. And those would be devastating. So right now, we're not talking about any of the innovative things that we can do to measure how funds flow or to direct them to address these issues or to ensure that there's equity. We're talking about destroying what's left. And after what was done with blanking up.
I'll give you half an hour to come up.
Yeah, thank you. TANF. I'm sorry, welfare reform, TANF. SNAP is the last one left that is really reliable. So those discussions aren't even happening. So step one would be to have those discussions.
Yeah.
Don't be so doom and gloom. These programs, the way they work, and if you go back and look at them historically, we kind of ebb and flow between block grants, categorical grants, earmarking, and it's the constant ebb and flow. But again, our challenge is down to earth planners in this game is being able to work with those challenges to move the needle in the direction that we think is the right way to move it.
Yeah. And Adria, do you want to end on any thoughts on this question or the one right before?
No, I don't think so. Am I allowed to ask a question? I feel like that's kind of backwards, but it's something that...
you can ask a question that would lead to like taking a census of the room on an issue.
Yeah, I think that something that I was thinking about when I was... And you don't have to hold this, I'm sorry. Something that I was thinking about, and it's just what we've been working through mainly after the election. So not to politicize it, but kind of understanding how the policies that we're creating impact rural areas. And when I think particularly about the intersection of health and transportation, a lot of the programs that we talk about are very focused on urbanized metropolitan areas. And so to me, and maybe it's like a takeaway, maybe this is good, you guys can have more discussions about it and then let me know where you land, because I'd like to understand kind of what the thought process is about developing policies and programs that can, lead to positive health outcomes in rural areas, because it's such a different environment to be working in. Yeah,
that's a great point, and I think a great way to end this conversation, and what an equity issue that we think about for rural communities. I'm working on a rural project now with a colleague at Baylor. And we're talking about those same sorts of challenges around sidewalks and lack of access for people in rural areas and lack of transit, and how does that impact opportunities for physical activity and other types of things. And it's an issue, again, here in Baltimore, we think a lot about the urban environment. This is where we are. But as an equity issue, rural communities and also tribal communities are also disproportionately impacted. So thank you for that question or that challenge for us to think about in this room. And I want to just take a moment, thank all of you for being here today. I know it's busy finals, end of the year time. So thanks to all the students who made time to come today. Thanks to our external guests who made time to come in today and be part of this conversation. And many, many thanks to our three panelists. So thank you so much, Ed, Christopher. Thank you so much, Adria Turner. And thank you so much, Lucinda Leslie, for making time out of your busy days to have this conversation with us and to raise this issue. So thank you all, and take care. Thanks.